that supported, right? You learn how to figure things out, how to deal with that uncertainty, how to keep on moving throughout your busy, full days, right? And I think that skill absolutely helps you survive training. And at the same time, though, it can make it more difficult to notice when actually seeking help or seeking support might actually be better at what you're doing that much faster. In clinical medicine, if we think about that, you certainly wait to deal with organ failure, at that point before intervening, right? We would look at preventative care, we would look at early signs, trends, risk factors, all of that, and you would act. But when we think about bonding ourselves as that system, sometimes our threshold for intervention is a little higher than in other places of our life. One point that I wanted to be really clear about in this conversation, this isn't me saying that physicians need more help. It's simply about reframing help seeking as a way of cultivating self-awareness, about continuing your professional development, and really a means to optimize the efforts and the good work that all of you are already doing. So, in one sense, we're taking this idea from clinical reasoning and we're simply applying it to help seeking in medicine. And that means earlier recognition, lower thresholds, and hopefully also less stigma around the help-seeking behavior itself. That being said, here are the things that we're hopefully going to cover here together. We're going to examine what the research says about physicians and help seeking. We're going to be exploring internal and external barriers to those processes, and certainly spend some time just sitting with, what are the benefits of when we do seek help, when we see others seek help. Along with that, we're going to take a look at current, and I say current because these things are always evolving, current institutional practices that really help support and facilitate physician help seeking. And then a good chunk of our time is going to be taking a look at individual practices. So these are the things that we can really practice ourselves that help us move through feelings of vulnerability, how to continue to foster a growth mindset, and certainly, again, how do we engage in help-seeking behaviors really along the way in our work. So why does all of this matter? I really can't think about talking about help seeking if I don't talk about vulnerability. So here's a few things that I want to share with you on that note. Simply put, your work matters, period. We know that, right? And anything that matters is always intrinsically tied to vulnerability. The research says these go hand in hand. If you didn't care about your work, there wouldn't be the potential of feeling vulnerable. So key point here, again, vulnerability is inherently tied to help seeking because it matters. If it didn't matter, you wouldn't care. And the interesting thing about vulnerability and what the research says about it, it also tells us that it's at the core of feelings of shame, that good old feeling of not being good enough, and fear, and our own struggle with worthiness. The interesting thing about all the shame research is that it also seems to be the birthplace of all the good stuff. So that includes joy, creativity, a sense of belonging, and certainly love. So all the good stuff that comes from your personal life and professional life is absolutely tied to feelings of vulnerability. So just leave you with that thought. Now, why does this conversation matter is, I would simply put, you matter and your work matters. So again, important for us to be thinking about. We're going to start with what I call a private pause. And so before I get into what the research tells us about physicians and help seeking, we want to kind of wrestle with that a little bit ourselves. So the goal here is really just to connect with some feelings and thoughts that arise when we consider and help seeking behaviors. So just take a minute, relax, and I want you to think about a time when you were struggling in the past. This could be when you were in school, it could be in training, this could be a job that you had, it could be even in your personal life. But during that recall of that memory, this is a time when you did not choose to seek help. And just take a moment to recall what that situation was like. You certainly don't have to remember every detail. I really want you to focus on kind of the thoughts and feelings when you chose not to seek for help. And in that moment, if you can recall what stopped you from seeking help, what you might have been afraid of if you chose to, and certainly how did you feel in that moment? All right, so want to get your wheels turning here. So hopefully you had a chance to think about something. And if you would for me, I want you to share just one word or short phrase that captures how you felt in that moment. I'm going to put up this QR code there that you can scan, and then you can go ahead and contribute to our conversation here today. So pull out your phone, scan that really quickly. And again, one thought, one feeling that captured how you felt in that moment when you chose not to seek help. All right, there's the QR code again if you need it. And I'll take that away here. So we can take a look at what we're thinking about here. All right, definitely some overlap, some commonality here. All right, kind of makes sense, right? Thank you all for sharing your thoughts there. Switch screens back to our presentation. And we're going to continue to add to that. And I want to share with you a short video. I swap screens here, and I have to MacGyver the sound system, so give me 1 minute. I'll be right back. I'm going to put the mic up to the speaker down here. So this video will quickly go over what the research tells us about physicians and help seeking.
You know, we think of doctors as these pillars of strength, right? They're the people we literally trust with our lives. But that idea of the unshakable healer, it raises a really critical and honestly often overlooked question. It's such a simple question, but the answer is anything but, because there's this powerful paradox right at the heart of modern medicine. The very people trained to heal us are often the last ones to ever ask for help themselves. And look, this isn't just a rare thing. The data shows this massive gap between the number of doctors who say they're in distress and the ones who actually, do something about it. So what is going on here? Okay, first, let's just get on the same page about what we're even talking about. Help seeking is just any time a doctor intentionally looks for support. That could be something formal, like going to therapy, or totally informal, like just grabbing a coffee with a colleague they trust. It's a planned, conscious choice. And here's what's so fascinating. The reasons a doctor might need help are incredibly broad and honestly super normal. This is not just about burnout. Let's take a look at the whole spectrum. And the reasons are things we can all relate to. It starts with the purely physical, right? Like managing a chronic condition or just dealing with the bone-deep fatigue that comes from those insane shifts, which of course connects directly to their mental and emotional health, the need to process the trauma they see every day or fight off that nagging feeling of imposter syndrome. And this need for support, it goes right into their learning, trying to find better ways to absorb a literal mountain of information. Or how about managing the crushing anxiety that comes with those career-defining, high-stakes board exams? Yeah, that's a big one. And in their day-to-day practice, it could be something like wanting to sharpen their diagnostic skills or getting feedback to get better at a clinical procedure. It's also about the long game, getting guidance on where their career is headed or figuring out how to become a leader. Then there's the whole human side of the job, getting better at delivering bad news with empathy or just navigating conflict with coworkers. And sometimes it's just about surviving the system itself, getting help to figure out billing or how to manage that soul-crushing administrative paperwork. Because of course they're people first. They need help balancing work and family or dealing with financial stress, just like the rest of us. And this last one brilliantly illustrates the key point. It's not always about fixing a problem. Sometimes it's about being proactive, about optimizing your performance to build a career that's not just successful, but sustainable. So when you look at that whole list, the need for help seems completely universal and, frankly, totally rational, which brings us right back to our central mystery. Why the hesitation? Well, the answer is all about the barriers, the ones inside their heads and the ones built into the system. All right, let's start with the barriers we build inside ourselves. These are the powerful, often unspoken beliefs and fears that stop a physician from ever making that call or knocking on that door. There are two major forces at play here. First, there's self-stigma. This is that little voice inside that says, "You're a doctor. You should be able to handle this. Needing help is a failure." And second, a very, very real fear of professional consequences, that seeking help for your mental health could actually put your medical license or your entire career at risk. And this is exactly where we need a huge shift in how we think about this. We praise doctors for being courageous helpers, but as researcher Dr. Brené Brown says, we forget that offering help is courageous and compassionate, but so is asking for help. But here's the thing. Those internal fears, they don't just pop up out of nowhere. They are constantly being reinforced by the very system these doctors are working in. And this creates a really nasty feedback loop. A doctor's internal fear that a diagnosis will hurt my license gets amplified by a very real external threat. The worry that their employer or the licensing board might somehow get access to their confidential medical records. One fear just feeds the other. And then you layer on top of that the culture of invulnerability, that old school suck-it-up mentality that's been baked into medicine for generations. Add in the practical stuff, not having time, services costing too much, or not being open after a 12-hour shift. It all builds this massive, formidable wall. So how do we even begin to take that wall down? Well, it starts by completely reframing what we mean by strength and courage in the medical world. So here's the bottom line. The solution is not to just tell doctors to be tougher. It's to change the entire culture. It's about recognizing that asking for support, whether it's for burnout, to get better at a skill, or to navigate a personal crisis, that's not a sign of weakness. It is a sign of profound professional commitment. It's a courageous act, which leaves us with one last really important question to think about. In a profession that's defined by all these heroic acts to save other people, what if the most courageous act of all is a doctor finally asking for help themselves? We think of...
All right, so thank you all for engaging, watching that video. This is a quick visual recap of the content that was just covered. I just want you to take a moment to review that. As physicians, you all belong to a profession that's literally built on help seeking, right? Even in your daily work, you're asking questions, you're consulting with colleagues, you're referring patients every day. And so in theory, right, these are really core professional values when we think about help seeking. So the harder question to ask, which again, this is something I struggle with all the time, is thinking about our professed and practiced values and the space in between, right? So if this is something that we say we value, do we put this into practice throughout our days? As you reflect on this visual recap of that video and what the research tells us about some of the things that get weighed into that, what do learners, what do your colleagues, what do even patients learn about help-seeking behaviors by watching how you respond to limits, uncertainty, and moments of struggle, whether they're your own or someone else's? As I said, reflective conversation here. And so I got another private pause for you. And now we want to shift our focus, not in terms of the way that things that can get in the way of help seeking, but the positive outcomes of that. And then we're going to turn to another quick video on what the research tells us about that. So this time I want you to think about a time where you did seek help and it resulted in some positive outcomes for you. And so as you reflect about that experience, think about what those benefits were for you, and how you felt in those moments on the other side of reaching out. And when you've had the space to do that, I also, again, you're in a help-seeking profession yourself, I want you to think about when you have seen others, whether those are patients, colleagues, friends, when they have engaged in help-seeking themselves, which led to positive outcomes. Again, what were those benefits and how did those individuals feel in those moments? All right, one more time for you. I'm going to put up a QR code. And so again, if you'd focus on the thought and feeling on the other side of that positive help-seeking experience, what was one short word or phrase that captures how you felt in that moment? Go ahead and pull out your phones, scan away, and curious to hear your thoughts. There's a QR code again if you need it. So what it's like on the other side of help seeking.
It's not letting us type in.
Well, that'll make it hard to respond, I think. Is anyone else having trouble? Thumbs up? Oh, well, how fascinating. All right, well, we're gonna go ahead and skip that one. But again, hopefully, oh, we'll call the thumbs up. I like that though. Appreciate the support there. All right, let me toggle back. And we'll keep on moving here. All right, so the point of those two activities reflective, right? We've all had experience when we chose actively not to seek help, and in times when we have. And again, the hope is when we have, we've seen the positive benefits of that experience. I know across careers, educational experiences, again, we've experienced these things, but again, leads to challenges and implications for our work now, especially when we're in the thick of our residency program. So with that being said, I wanted to again show you a quick little video on what the research tells us about the value of help seeking, specifically related to those who are physicians. So here you go.
In medicine, we tend to talk about professional support as this safe.
Thank you.
Net, right? Something for when things go wrong. But what if we've been looking at it completely backwards? Today, we're going to reframe that whole idea. We're going to explore how support isn't just about crisis management. It's actually a core strategy for achieving and maintaining peak performance, just like it is in any other elite field. So think about this for a second. What do elite athletes and, say, top surgeons really have in common? I mean, sure, there's incredible skill, dedication, grace under pressure, all that. But the secret ingredient, the one we so often ignore in medicine, is their strategic use of support. No world-class athlete gets to the top alone. They have a whole team of coaches, trainers, and specialists pushing them. So why on earth should medicine be any different? And let's be real here, the cognitive and emotional price of a medical career is just immense. But this isn't just about a physician's personal struggle. This has a direct, measurable, and sometimes incredibly dangerous impact on patient care. And that's the core problem we're going to be digging into. Okay, first up, the elite performance playbook. This is where we completely shift the conversation. We're moving away from that old, frankly outdated idea that asking for help is a sign of weakness and towards seeing it for what it is, a powerful, proactive strategy. Here is that mindset shift, laid out plain and simple. The old way of thinking sees support as a last resort, something you turn to when you're already breaking down. But the strategic view, it completely flips that on its head. It's a tool for excellence. It's proactive maintenance to stay sharp and to stop problems before they even start. It's a performance strategy, period. And this quote just nails it. You would never, ever look at an Olympic athlete and say, wow, having a coach is a sign of weakness. Of course not. That's literally how they become the best in the world. The exact same logic applies here. Okay, so if we buy into this strategic mindset, what are the actual tangible results? Well, that brings us right to our second section, the clinical and cognitive edge. Now we're going to look at the hard evidence that connects a physician's well-being directly to their performance where it counts the most, with patients. So what happens when stress just builds up unaddressed? You get this really dangerous progression, what we can call the burnout cascade. It kicks off with chronic stress, which then snowballs into burnout. That burnout causes measurable cognitive impairment. I'm talking memory, attention, the works, which then directly, and I mean directly, increases the risk of medical errors. It's a predictable and importantly, preventable chain of events. But here is the really crucial part. This whole cascade is reversible. Proactive support doesn't just put the brakes on it. It actively rebuilds your cognitive strength. We're talking about sharpening your executive function for better attention, improving your diagnostic accuracy, and giving you that cognitive flexibility you need for those really complex out-of-the-blue cases. It cuts down on cognitive overload, and ultimately, it reduces the risk of making a mistake. And listen, this isn't just some nice theory. We've got the data. The numbers are clear. Residents and attendings who deal with their stress early and proactively consistently perform better on those huge high-stakes milestones, like in training and board exams. It is a clear-cut, measurable performance advantage. But this isn't just about the short-term wins, like acing an exam. It is absolutely about the long game. And that brings us to our third section, building a truly sustainable career by investing in your own longevity and leadership. How do we make sure the best people can thrive in this profession for decades? Well, when physicians start using support as a regular tool, the long-term payoff is just massive. For one, it makes their careers way more sustainable, which means we see less burnout-driven attrition and fewer people retiring early. But it also helps develop those critical leadership skills, empathy, clarity, adaptability that are so essential today. It helps them hold on to their professional identity and fight off that cynicism that can creep in over a long career. Now let's talk about the time commitment, because you hear it all the time, right? I'm just too busy. But let's really think about the cost of time. Is the real cost that 1 hour you spend with a coach? Or is it the weeks of inefficiency, the months spent in remediation, or worst of all, the years lost when a brilliant physician leaves the profession entirely? This isn't a cost. It's an investment with a huge return on productivity and career longevity. So if this is such a game changer for individual doctors, just imagine the impact when it becomes baked into the culture. In our final section here, we're going to explore that ripple effect and what it really takes to build a true culture of strength. It all starts with this one crucial concept, psychological safety. This is the absolute bedrock of any high-performing team, especially in a high-stakes field like medicine. It's that shared belief that you can speak up, that you can ask a question, that you can even report an error without being humiliated or punished for it. It is the exact opposite of a culture of fear. And that's the thing. When leaders and senior physicians actually live this, when they model this behavior, they create that psychological safety. They make it okay for a junior resident to say, hey, wait a minute, which might just prevent a catastrophic error. They normalize a growth mindset, and they just demolish the stigma for the next generation coming up. And the result? You get a team that learns faster, adapts quicker, and is just fundamentally stronger and safer. When you put all this together, you arrive at a pretty profound conclusion. Seeking support is not just some optional, nice-to-have form of self-care. It is a fundamental ethical and professional responsibility. It's about maintaining your fitness for duty so you can provide the best and safest care possible. Just let this one sink in for a moment. Think about what this means. The choice you make has real consequences. Ignoring your own distress isn't some stoic act of personal strength. It's an act that actively increases the risk to your patients and to your colleagues. Seeking help, on the other hand, is an act that protects the entire team. So I want to leave you with this final thought. If we accept all the evidence, if we accept that support is a proven tool for making you better at your job, for reducing errors, and for ensuring a long, healthy career, then the question becomes, isn't it actually unethical not to use it? It's a question that really challenges the very foundation of medical culture, and it reframes this entire conversation from one of stigma to one of absolute professional obligation. You know, in medicine.
All right, going to share a visual recap with you as well, so you can take a look at that. And just curious from the audience if there's anything that resonates with you or anything that you would add to the benefits or the rationale for using this as a strategic approach, proactive approach versus reactive. I think back to when I was working with medical students. This was an MS1, his first year, and I remember a meeting came to my office and he said, dude, I don't know what a learning specialist is, but I'm sure glad I have one. And I met with him across his 4 years, but that very much reflected his mindset about, hey, like these are resources, I'm here to learn and grow, and probably as a learner and certainly as a future physician, there's probably some stretches for me, and how can I get some feedback and support to be able to do that? So a lot of this is simply about reframing, again, things that we know are good for us, but may not always take the time to act on. Or when we do act on it, it may be, again, a little increase the challenge that we could have been a little more proactive on the front. All right, so I'm going to switch the slide here in a minute, but one thing that I thought of when I was looking at this recap that the AI generated for me here is this is something that we know from our clinical care, right? That performance isn't about endless endurance. Nobody can do that. We're all human, but it's really about timely intervention. So as you take that in, this is really the question I want you to kind of ponder as we continue our conversation is where in your work whatever aspect that may be, when you're relying on endurance alone, perhaps right now, where support may actually be more effective. So put that differently, going kind of back to that diagnostic threshold. If you were to hold yourself to the same standards with your patient care, using that diagnostic threshold, where might you act sooner in terms of seeking help and support? All right, we're going to switch our focus now, thinking about institutional practices before we kind of, again, grapple with individual practices. So again, these are things that help facilitate and support physician learning, well-being, and certainly professional development. First, this is kind of the broadest stroke that I wanted to share with you all. This is the help someone form. So this is Creighton-wide. And if you don't know where to go at any point, whether this be for yourself or someone else, you can simply scan that. It takes you to that form, and someone on the Creighton team will follow up with you with potential next steps and resources. So no, that's kind of a catch-all for all things. Now, if the needing to seek help is a little more acute, especially if it involves patient care or physician impairment. Always best step there in that front is always to contact the service leadership on hand. After a long shift or a very full day, again, we want to make sure you get home well and safe. And so that's why we have the Safe Ride Home program is available to you. You can access more details about the program and how to make that happen by clicking on or scanning the QR code there on the Wellbeing website. Access matters too. So, I always want to mention this one because disability population is one that we'll all be part of at some point in our life. So a good thing for us to be thinking about if at any time you anticipate or experience a barrier based on a temporary or chronic medical condition or disability. Human Resources is your contact for that. The Creighton Disability Awareness Committee was created to both provide information and help determine reasonable accommodations on a case by case. So again, contact number is through Human Resources. Physician learning, I'm a little biased on this one. I like this one a whole lot. My role here, right, is really targeted on being a resource academic coach for all of you, providing learning consultations, coaching sessions, whether you're gearing up for your level 3 exam, in-training exams, or ultimately your specialty board exam. Again, I meet with lots of residents day in and day out, and it's not that something has to be going wrong to be able to, oh, I'm going to go meet with dude. It's like, hey, like, what can I figure out? What's my stretch as a learner? How can I continue to optimize, the good work that you're doing along the way? I did want to share on this note because I think it's pretty cool. And again, I know I'm biased on this one. I am part of a small team who's gathering together learning specialists across the country who are doing this work in the graduate medical education space. We did recently a survey out to that group of 90 some individuals. And interestingly enough, I am one of 3 people in the country right now that I'm aware of doing this work full time. So that makes me very proud of Creighton that they're looking ahead at saying, hey, we care about our physicians, we care about their learning and their academic success. We value it enough that we're actually going to have a full-time person dedicated to our learners here. And on that note, again, well-being QR code and the QR code for learning there takes us to, again, a unique thing, and I'm probably sure it's the only one right out there in the country right now, is a whole website dedicated for you all on learning and board readiness. So there's a whole section on level 3 exams, if that's something you're still working on. And then there's a section on general learning and study strategies, on-demand videos, and then a page that probably gets the most traffic has it linked by specialty. So in that has different templates, tools, quick links for resources, all kind of the go-tos based on the academic side, learning side of your program. What else do we got here? Safe place to share. We do have an ombudsman resource. And the whole idea behind this, right, is that this person is independent, impartial party, providing a safe place to share any training related concerns. The easiest, best way to contact that person is just to simply email the main Alliance Creighton email, and we will put you in touch with that person. The bottom line here, so if you remember anything from these slides about institutional practices, you all are always encouraged to seek help voluntarily, period, right? And that's before clinical, educational, professional performance is adversely affected. Anyone who seeks out help, who voluntarily seeks out this assistance, their employment will not be jeopardized because of taking that action. And last but not least, I'm sure you all know Julie, who's sitting at the table up front here, my wonderful colleague and friend. If you have questions about any of these resources or not sure where to go or how to get someone else connected, you can always reach out to Julie. You can certainly reach out to me, and we'll make sure we get you to the right place. All right, so now we're shifting our focus to those personal practices that are really focused on how do I actually move through these feelings of vulnerability, because there's really no getting around that. Dr. Brene Brown says, we don't do vulnerability, it does us. So if we ignore it, it's just going to push its head up eventually. So again, how do we move through those type of feelings? In medicine, I think feeling vulnerable is pretty normal, and there's lots of reasons we may do that. One, remember, it's vulnerable because it's important to us. But sometimes it's a signal just of, this is a pretty significant cognitive load, a role strain. Sometimes it's system mismatch. There's lots of reasons why we may feel that uncomfortable feelings that come with vulnerability. But responding and acting, here's the good thing about it. It helps protect performance, learning, patient safety, and ultimately, the longevity in your careers. So what are those individual practices? First, we just got to recognize that vulnerability is part of it. I've listed here some common signals or kind of feelings when we may be feeling vulnerable, but I really like this idea of reframing feelings as data. So I'm sure many of you have heard the expression WTF. Right. And now in this context, it's not quite what I mean, but when we're thinking about our feelings, something that I remind myself is WTF, what is the function? So what is this feeling actually trying to tell me here? When it comes to vulnerability, again, it's probably a signal, whatever you're feeling vulnerable about, it's probably just because it's really important to you. What else? Normalize that vulnerability. I don't know, again, how to separate vulnerability from your experiences. We know you all work in high stakes, complex work environments. Vulnerability is simply expected. And I would say certainly the absence of any strange or discomfort would probably feel pretty unusual. So in those moments, when you're thinking about seeking help, what would you expect a competent colleague or a friend to do in that same situation and apply those same standards to yourself, right? And we certainly want to separate help seeking from impairment. And that's, again, a reframe of thinking about, this is actually about preventative maintenance. This is about performance optimization. And this is about my professional development, not me being, quote unquote, a bad or ineffective physician, right? So where do we start? We can start with low threshold support, right? You don't have to begin with what may feel the most vulnerable option. It could be just connecting with a friend or colleague, right? It could be somebody within your program class, or it could be someone a little further down the road from you. It could certainly be a coaching option coming in. My meetings with residents, they're private consultations. I'm not, going back and reporting to your PD about the things that you're sharing with me. Same for many of our resources. Again, we try to create a safe place for you to be able to share and kind of work through those thoughts and feelings. And again, keep you moving forward in the good work that you're doing. What else here? Shift from self-judgment to clinical reasoning. And I think this one is really all about how do we avoid moralizing distress and treating yourself more like a complex case, whatever you may be experiencing, rather than this is a reflective of being some type of character flaw with you, right? How do we tolerate that discomfort? I don't know how to get through vulnerability. They're experiencing vulnerability. That's really the challenge around it. And when seeking help, again, that feeling of vulnerability may not instantly disappear. It may actually, increase as you initially engage in a help-seeking behavior. I know when I sit down with someone, it's inherently vulnerable. They're sharing what they're doing, what they're not doing, their struggles when it comes to, gearing up for an in-training exam or a specialty board exam. I joke sometimes, it's like, I'm like, you're not coming into confession. You're not, telling me how many Q-bank questions you've done or didn't do. I'm going to resolve you from your sins or anything like that. I'm there to meet you where you're at in that moment. But again, acknowledging that it can definitely be, a vulnerable conversation about, sharing about yourself and where you're at with things. But just because it's uncomfortable or some discomfort doesn't mean that you're doing something wrong or that's not the right next step for you. And last but not least, anchoring help seeking into your values, right? So this is really about reminding yourself about why you're seeking help to begin with. So is this really centered around patient care? Is this about, heck, I just really want to learn this really well because I know that's going to make me a better physician? Is this about my own leadership development, my teamwork? Or is this about, hey, medicine is really important to me. I want to be here in this career for the long run. How am I taking care of myself along the way? Lots of reasons why, again, our intention behind self or help seeking helps us make that decision to persist through sometimes those feelings of discomfort. Okay, we're going to begin to wrap up our time here together. And this is to acknowledge the fact that sometimes when we seek help, it isn't helpful, right? So we know that help seeking, there's lots of complexity, lots of different nuances, situations that we could all think of about this topic. So I'm floating still really like at 10,000 feet above this, but wanted to give you some ideas and strategies to think about when you do seek help, and maybe it's not exactly the help that you were looking for. So, this probably happens more than we would like to admit, but when we ask for help, sometimes help isn't guaranteed, right? On top of that, sometimes help can be unclear. Hopefully not, but it can certainly sometimes perhaps feel dismissive. I think probably more often than that, sometimes the feedback that we get or the help that we get is just a vague response. And it's like, well, I'm not feeling any better than I did before I asked for help, right? So again, those are pretty common things, but an unhelpful response isn't about you. That is what I would say that's a system gap, not a personal failure, right? So here are some things to think about when those situations may happen. Very first of which is to pause and reframe, thinking about that response isn't equal to my worth or my competence. And that's really separating what you needed versus how it was handled. Those are two different phenomenons, right? We can clarify, right? We can always ask one more time to that person that we sought help for, we're getting feedback from, if you're feeling safe. And I'll add the caveat there, if you're feeling safe. But what I would encourage you to do is try to ask for help more specifically. So that could look like something, could you give me one concrete thing to work on, right? What would improvement look like? Ask that person to describe that to you. Is there a resource you would recommend? If it's still vague, I would say move on, right? There's other options for help seeking. And some of those is redirecting. So you have, right, got some agency and choice here. You can decide who you seek help from, in lots of different settings. If we think about from a clinical reasoning perspective, is there an attending or a senior that you could engage in a conversation with? If it's a learning study strategy, right, you got a learning specialist that you could lean on. If it's well-being related, okay, is there a friend, close colleague, or even a near peer, mentor, wellness lead? You have options of people that you can go to engage with about questions and concerns about your well-being. And from a systems level, we can engage with chief resident and program leadership. So again, just reminding, like there's usually more than one pathway in any help-seeking behavior. Along those lines, you can ask for a request or a handoff. So again, if you get feedback from someone or again, seeking help and it's like, that didn't hit the mark for me, you can always ask them like, who would you suggest I talk to? Where do you think I could learn more? Could you connect with me with someone, or is there a resource that you could share with me? The part here, which sometimes where we stop is if we don't get that referral or that connection, sometimes we take that as a sign like, I'm just going to stop here. That may actually be a signal just to go deeper or to change your strategy from a help-seeking behavior. What else can you do? This one sounds a little formal, but document for yourself. And this is really about, what was that request about? Why did I seek help? What was the response? And what remains, unclear for me? And that's really there just to one, get your thoughts out of your head, to clarify next steps, and also prevent repeated dead ends, right? If it's the same question over and over again, and you keep getting the same response, well, that's not a helpful help seeking process. So again, capturing that, okay, I tried this strategy, where can I go to next? That'll support those future clarifications. But honestly, I think part of it of just getting out our helps validate the reason for the question, to begin with, right? Seeking parallel supports. This is similar to some of the other strategies I shared. You just don't need one channel, and sometimes one channel isn't enough. Having multiple supports can help us, again, do the good work that you're doing. That could be trusted peers, near peers, learning specialist, coach, faculty mentors, program, faculty in your program, outside of your program. Again, the list goes on here. And last but not least here, I have escalate when needed. So there are times that I would say, yep, we tried these kind of general strategies, but this is time where something's going on. It's pervasive, it's significant enough. I need to seek help in a different way. And certainly things that I would say time to escalate if this is related to learning and or patient safety is affected, right? We know seeking help is absolutely part of our obligation. If you're feeling dismissed or you're feeling like repetitive shaming, again, a reason to escalate the situation. But ultimately, if you're just feeling stuck or unsupported, again, resources there to help you do that. Possible pathways, your chief resident, faculty advisor, mentor, program leadership, the ombudsman that I mentioned earlier, or anyone in the GME office. All right, believe it or not, I think we're getting somewhat close to the top of our hour here. So wanted to wrap up with a few final thoughts. Again, hopefully the conversation, again, thinking about help seeking, it's just part of what's expected during residency. We know the work is hard and really, in reality, no one is meant to do it alone, right? We know that sometimes responses aren't perfect, but that doesn't mean that your response of seeking help was a bad move. It just means that we got to continue, persist, and see that as actual professional practice of something that we do, because at the end of the day, it shows that self-awareness, insight, growth, and care for the physician that you all are, continue to grow into and become. I think in my work, the strongest residents I work with aren't the ones that push through silently. Those are the ones who notice early, who observe, speak up, and adjust along the way based on the feedback that they're getting one way or the other. So as you all move forward, again, I hope you don't think of help seeking as a detour from your competence, but actually a way of part of how learning to practice medicine really well.